Hello everybody, welcome back to my channel. My name is Pinky. I'm an advanced clinical pharmacist practitioner. Today I'm going to discuss about menopause, okay? What is menopause? What are the symptoms of menopause, the contraindications, treatment options, counseling, and so much more. So what are the symptoms of menopause, okay? The symptoms of menopause are like hot flushes, night sweats, menstrual irregularities, okay, irregularities in having period, sleep disturbances, can't sleep at night, loss of sex drive, mood changes, cognitive disturbances like confusion and things like that, vaginal dryness, vagina will go dry, urinary problems, joint and muscle pain. So these are the symptoms of menopause, okay? So now I'm going to discuss how to diagnose menopause. So basically menopause is diagnosed by the symptoms, by the typical symptoms which I have described, and in a woman who is like more than or equals to 45 years old. So obviously I need to also think about is this abnormal bleeding, is it related to menopause or not related to menopause? And then we're going to think about the differential diagnosis, okay? Differential diagnosis can be like tumors, thyroid problems, alcohol abuse, drug abuse, and I'm gonna go for follicular stimulating hormone test in patients who are like less than 45 years old or less than 40 years old, and or in women who are more than 50 years old and want to stop hormonal contraceptive pill. So the treatment options, there is three: lifestyle, hormonal replacement therapy, and alternative to hormonal replacement therapy. So let's discuss about lifestyle first. For lifestyle, regular exercise, maintaining a healthy body weight, stop smoking, reduce alcohol intake, avoid spicy food, reduce stress. You can do yoga, relaxation exercises, sleep hygiene. And for hormonal replacement therapy, obviously it will help with the low mood and with the symptoms, and it is beneficial to increase the sex drive, and it will prevent any kind of vaginal abnormalities, any kind of bone problems. And alternative to hormonal replacement therapy is like cognitive behavioral therapies, and there is something called isoflavones, soy and black cohosh, which you can buy over the counter. However, the safety profile, we are not. So before I discuss about the treatment, I will discuss about the contraindications. Contraindications means in cases when as clinicians we are not going to recommend the hormonal replacement therapy. For example, if there is a history of breast cancer, or if there is like a hormone dependent tumor, the name of that hormone is estrogen. If there is like untreated endometrial hyperplasia, it's a vaginal condition, disease, undiagnosed like vaginal bleeding, uncontrolled hypertension, okay, uncontrolled hypertension, uncontrolled high blood pressure, any kind of clotting problems, blood clotting problems, and any kind of liver disease. So these are the contraindications. I'm going to discuss about the treatment is in the most simplest way possible. It is quite complicated, but I'm gonna explain it without any medical jargons, okay? There are three kind of or types of hormonal replacement therapy for menopause, to treat menopause. One of them is estrogen only hormonal replacement therapy. One is sequential combined hormonal replacement therapy. Another one is continuous combined hormonal replacement therapy. For estrogen only hormonal replacement therapy, it is for women without a uterus or with an intrauterine device. Okay, it's like a T-shaped plastic inserted into the womb. So this is estrogen only hormonal replacement therapy. It is used for women without a uterus, who doesn't have a uterus, and with an intrauterine device. So the second one is sequential combined hormonal replacement therapy. Okay, this is used in perimenopausal women, in women before the menopause, okay, is about to come out. So in this sequential combined hormonal replacement therapy, there is like two hormones, the daily estrogens with like a sequential progesterone. Estrogen is one hormone, progesterone is another hormone. So in sequential combined hormonal replacement therapy, there is like daily estrogen with sequential progesterone. Usually the progesterone is in the last 12 to 14 days of the pack, which triggers a bleed. Then we are going to discuss about the continuous combined hormonal replacement therapy. So the third one is continuous combined hormonal replacement therapy. This is used in postmenopausal women, okay, in women who didn't have their period or who had their last period like 12 months ago, okay, didn't have their period for at least, didn't have any menstrual bleeding for at least a year. So in this continuous combined hormonal replacement therapy, basically it contains like daily estrogen and progesterone, which are the two hormones. Okay, now we are going to switch from sequential combined hormonal replacement therapy to a combined hormonal replacement therapy after 1 year of sequential hormonal replacement therapy, or in women more than 54 years old. Okay, this is very important to understand as well. Now I'm going to discuss about some very important facts about this hormonal replacement therapy. That is, we need to also think about contraceptive pills, contraception. Now obviously contraception is not required if somebody is less than 50 or 50 and didn't have any kind of menstruation in the last 2 years, or more than 50 and didn't have any period in the last 1 year. Okay, now if someone is less than 55 and is sexually active and is menstruating, there are a range of options for them. Okay, along with the hormonal replacement therapy, we can give them like estrogen only pill, patch or gel plus Mirena coil, and not other intrauterine devices. So other options can be like combined hormonal contraception. Another option is sequential combined hormonal replacement therapy. Together with that, progesterone only contraception. And if another option is if doesn't have any period, can have like with progestogenic contraception, can use the continuous combined hormonal replacement therapy instead of the sequential combined replacement therapy. If declines contraception, then I will definitely offer like barrier method such as like condom. So this is very important. Also important like to stop the hormonal contraception at the age of 55 years old. I will review the patient after 3 months and then annually. While reviewing, I'll check the symptoms, I'll check the side effects, I'll check the ongoing indication. I'll stop the HRT if the patient is happy to stop it and if the risk outweighs benefit. But after 5 years, usually I advise to go for a drug holiday. And for troubleshooting is also important. Like there will be problems after starting HRT. The problems can be like persistent abnormal bleeding beyond 6 months that needs to be investigated. Bleeding after starting the continuous combined hormonal replacement therapy. And if it doesn't settle down after 3 to 6 months, I will swap it to sequential hormonal replacement therapy for another 12 months. Heavy bleeding on sequential hormonal replacement therapy, increased dose, duration of progestogen. There can be progestogenic side effects like headache, breast tenderness. I'll switch to alternate. As I was saying about progestogenic side effects, if someone has got like progestogenic side effects such as headache, breast tenderness, diarrhea or constipation, other side effects, I will switch to alternative progestogen or consider intrauterine devices. Now, for hormonal replacement therapy, there are options like oral tablets, right? That's the first choice. When I'm gonna use the transdermal, I'm gonna use the transdermal in patients who are like more than 60, overweight, or has got migraines, because transdermal patches has got like fewer risks of blood clots, heart problems. And if the patient complains about, vaginal problems, vaginal dryness, and that problems predominates, then I'll consider like vaginal estrogens instead. I will give a list of medications of the different types of hormonal replacement therapies present. I'll give the generic names as well as the brand names. Now, it is very important to counsel patients on HRT, like hormonal replacement therapies, about that there can be increased risk of breast cancer, there can be increased risk of having blood clots, like heart problems, stroke problems, ovarian cancer. So before any medication, before you take any medication, it is very important to read the patient information leaflet. Read it carefully, look at the side effects, look at the contraindications, the cautions, okay? And then take the medication, okay? So that's all about hormonal replacement therapy in menopausal or premenopausal or postmenopausal women. If you have any questions, put in the comment section below. Thanks for watching. Do like, share, and subscribe my channel. Follow me in Twitter, Instagram, like my Facebook page, Clinical Pharmacist Practitioner Pink, if you want to get updated news or videos. Pretty much that. Thank you. Stay safe. Bye for now.